Hi, my name is Valerie Hodson. I am a physical therapist from Massachusetts region. I am in the North Dighton area, and I'm a Polestar Pilates practitioner. Today, what we're going to be showing is an exercise on the trapeze table using just one spring sprung diagonally. This exercise is wonderful for gymnasts, dancers, cheerleaders, and possibly even swimmers that are exhibiting some lumbopelvic instability, perhaps some low back pain, that are recovering from a spondylolisthesis, any type of injury of that nature. So what we're going to do is we're going to take this spring. We're using the crossbar so that we can play around with the tension. And I'm going to go ahead and I'm going to bring it across to Hilda's leg here. And I'm going to have her press long, right out into a straight position. I'm going to first start with her leg supported so I can keep an eye on what's going on here at the pelvis. So Hilda, I'm going to have you go ahead and press your leg down and sweep it out into a little bit of a smaller circle so I can keep an eye on what's going on here at the pelvis. And wonderful. And let's go ahead and widen that circle just a little bit. And what I'm watching for here is I'm making sure that she's keeping her length as well as keeping the stability at the pelvis. And so from here I'm going to go ahead and reverse the circle. Wonderful, reaching out, and she can start to make the circles a little bit larger, but I want to still keep them in a controlled range of motion, because with most of our dancers and our gymnasts, they like to go out into those extreme ranges of motion. And we want to make sure that we're controlling here and not going beyond what her pelvis is capable of staying stable with. So as you can see, if she goes out too far, her pelvis is going to start to rock, or perhaps she's going to become short here in the spine. So once we've established that she's got control here in the stable position, we're going to go ahead and bring her leg up to 90-90, and then we're going to investigate and see what happens here. So going ahead and pressing down through the middle, sweeping out through the side, and now we're going to watch and see what happens. And as we see, we're starting to lose that a little bit, so we're going to have her draw down through this pelvis a little bit, connect through the ribs just a little bit more, and now go ahead and start to go through her circles again. So now we're starting to see that she's getting a little bit better connection. We can still create a little bit more through the rib cage here. And then we can start to investigate foot position as well. We might have her go into a little bit more internal range of motion, rotation there. So press down through the middle. We might see what happens with that. So I'm going to have you stay internally rotated the whole time. Yes, so press through the circle the whole time, internally rotated. And so with your dancers, that may find to be a very challenging position for them to hold the internal rotation. Whereas if you let them externally rotate, so now you can go with your toe in turnout, they may love the turnout the entire time. So this is just a few ways that you can play around with just having the spring sprung across, and we're going to go ahead and let you lower your leg down now. I'm going to go ahead and take this out. So there's many different ways that you can play with this. You can, again, let the crossbar go up a little bit higher for more tension, which is going to give them a little more support. You can then bring it down a little bit, which is now going to be a much lighter spring, and it's going to challenge the pelvis a little bit more. Those are just a few ways that I like to play around with this exercise. Thank you so much.